Good afternoon, ladies and gentlemen. I think I am an odd man out here coming from the health sector. As usual, I come to attend an emergency call. It's not a part of the panel discussion, but I was supposed to deliver a keynote session at 4 o'clock in the e-health session, and I was called. But this subject was so dear to me, so as soon as the dependent told me that I should come and be a part of this, I readily accepted, because in the health sector, maybe I've been in the field of hospital administration for the past 25 years since I joined Apollo in 1983. Fortunately for me, I've been always working in the large hospitals. Today I'm working in a hospital group which handles about 1,000 beds. For your information, if anybody is wanting UID, the most it is the health sector. Can you believe that health sector is the only one area where this UID will be used by everybody in this country? Okay, if you're talking about PAN, the people who have the IT. Maybe if you're talking about the credit card, you're talking about the rich people who want to handle it. If you're talking about transport, people use rail transport or road transport or whatever. But every one of us, talking about 130 crore population, every one of us in our lifetime, when we are born till we dead, definitely we will go to some hospital or other. Be it the primary health care center, nor a small district hospital, or a private hospital, or a tertiary care hospital, all of us need to go to a hospital at any point of time. So, any one point of time, and we need this ID. But, having said that, identification number is extremely important for people like us who are handling patients, thousands of patients. Believe me, in my hospital itself, I handle about 1,200 patients a day in Coimbatore. It's a large hospital. And we also have hospitals in different locations, so we need to handle those patients and those identities, and we have to manage the data with the dental settled data server. Just to give you a very short idea about how the identification works, whenever a patient walks into the hospital, we have what is known as a master ID number. We call it the MRD number. And maybe if he is an OP patient, we use that number for that particular visit and we done with it. Maybe next time when he comes, we use that number. But if he becomes an IP patient, if he becomes an inpatient, we have an IP visit number. So each patient, MRD patient, has 2 or 3 IP visits. Maybe a person had open heart surgery in the hospital way back in September 2001. He comes for a review in 2005, and I need to have another admission for it. So it's a different number. But one big problem I have, or maybe people like us all over the country, be it in the private sector or in the public sector, have this problem. How do we know the real identity of the person? Okay, for all you know, they would have lost that ID card, and so they will come and register as a new patient. So we have too many duplicates in the hospital. That happens particularly in the government hospital. For your information, in my hospital, if I handle 1,000 patients a day, my neighbor, Coimbatore Medical College Hospital, handles 6,000 patients a day. 6,000 outpatients a day and 2,000 inpatients a day. But whereas I handle only about 500 inpatients a day. Just imagine the data that they will need. And most of the time they wait for registration. The main waiting time in the government hospital is only registration because their identity is not established. But if this UID is done, the greatest advantage will be that maybe people like Mr. Nanantani and his group, and his group have already done the identification. He talked about the trusted identity information. That's exactly what I want. If you can provide that trusted identity information onto my net, and I simply put that demographic details into my database, and I issue the identity MRD number within about 2 or 3 seconds after I see it. Like you see the passport being passed in your immigration. So I think it's extremely important for us in the health sector, and all of us, be it in the private sector or in the private public sector, we will use it. But coming to 4 or 5 very important areas which I think will be extremely useful. God forbid a patient dies in the hospital. Okay, the problem is we have to settle the life insurance. There I have to declare his identity. And I always have a problem, the name is misspelled, or somebody even manipulates the name. All the problem is that I sign with some kind of a reservation. But he is going to get about 10 lakhs or 20 lakhs or 30 lakhs for reimbursement. But if I have that UID linked to my MRD number, I have no qualms at all. I will do it very fine. Similarly, the MLC cases, medico-legal cases, when they land up into my hospital, I am supposed to report to the police if I can know the identity, nothing like that. Similarly, when I issue the death certificate, birth certificate, when I issue the wound certificate, kidney transplant, donors change their names and come. How do I understand that? I think UID can play a very important role. Recruitment of people. You know something? Hospitals are the largest employment providers in the country today. So we employ for a 500-bed hospital, we have 1,500 employees working with me. Their families are working. And similarly, the BPL programs that are being issued by governments like Andhra Pradesh, maybe Tamil Nadu government, we are talking about giving insurance for 1 crore BPL families, and how do we establish their identity. And all that can be done very, very nicely, but I have a feeling that we cannot replace our MRD number with this UID number. We could always map the UID number to our MRD number and be very confident. And one thing we could do is we can import and we can reduce the time we key in all those details, and it will be extremely useful, and that's what I need to say. Maybe I will be able to answer a few questions. Thank you so much for the time.